This video will show you how to perform station 1 of the biomicroscopy practical. So my hands are washed, my room lighting is dim, my patient is comfortable, and I've focused my slit lamp and explained the purpose of the procedure to the patient. So using 10x low magnification, I am going to scan across the upper lid and lashes while my patient's eye is closed. She has some mild debris along the base of her lashes, so I would note that or maybe record mild blepharitis. And I'm going to go from canthus to canthus. Now that we're done, we're going to have her open and look straight ahead while I scan across her lower lid and lashes. And everything looks normal. So we're going to finish scanning that tissue. Maintaining focus best you can. I'm going to pull down the lower lid and lashes so that I can look at the meibomian gland openings, and they look open, normal. Again, just readjusting my focus as I go so that I can see what I need to see, flipping my light source when I meet the middle of the eye and regaining focus. And here is the inferior punctum, and it is open. Next, I'm going to do the same thing I just did, but on the upper lid. So I'm pulling that lid margin back. Here is the superior punctum, and here are my superior lid margin and meibomian glands. And that is a capped meibomian gland right there, so I might make note of that in my recording. And this patient also has a small nevus on her lid margin, so I would record that as well. Next, I'm just preparing to examine the inferior palpebral conjunctiva, so I'm going to tell my patient to look up, and I'm going to pull that lower lid down all the way, exposing that inferior palpebral conj. Here we go. Scan across it. Nice, pink, quiet, normal looking. We're going to scroll up while the patient is still looking up, and I'm just going to dim my brightness here so that the conj isn't washed out on the camera. And we're going to scan across the inferior bulbar conjunctiva. And now she's going to look to the left, and I will scan the temporal bulbar conjunctiva. Make sure I'm in focus. She's going to look the other way. I switched my light source to the nasal side, and I'm scanning the nasal bulbar conjunctiva. And next, the patient is going to look down, and I will pull the upper lid back and examine the superior bulbar conjunctiva. And it's all white and quiet. I'm going to next invert the upper eyelid using a cotton swab. So my patient is looking down. I am just getting the cotton swab in place and flipping her eyelid. I'm going to hold it with my left thumb since this is her right eye. And I'm going to scan across that superior palpebral conjunctiva. And again, it looks pink and quiet. All right, next we're going to examine the cornea with low magnification. You are supposed to use a parallel pipette. I accidentally used an optic section in this video. I apologize, but please use a parallel pipette on your proficiency. But you can see I'm turning up my brightness to make sure you get a good view of the cornea, getting my beam in focus, and you can still follow exactly the same pattern that I used. So I'm scanning the entire corneal tissue from edge to edge, maintaining focus the entire time, flipping my light beam when I reach the center of the eye, and scanning to the opposite limbus. And because I missed some of that superior corneal tissue, I'm going to pull the patient's upper eyelid out of the way and scroll up a little bit to scan that area of the cornea that wasn't in my view originally. So here we are doing that. Great, next we're going to examine the iris. So I'm going to make my beam wider, decrease my brightness so it's not overexposed, and scan across the iris tissue, again, flipping my light source when I reach the middle of the eye from temporal to nasal, and again, pulling the eyelid out of the way so I can examine the entire iris, including the superior part, and it is flat and intact. And lastly will be, oh, just kidding, we have to do the lens. So I'm going to narrow my beam down to an optic section and turn my brightness all the way up so that you can appreciate that better on the camera. And here you can see I'm scanning my patient's anterior lens capsule from temporal to nasal, making sure that looks clear. Then I'm going to push into the posterior lens and scan across that surface. You can see it in focus now, that yellowy area. And then I'm going to, I made it a little brighter for you there, I'm going to pull back and then just demonstrate that I can focus on all 3 layers of the lens. So there's the anterior lens, there's the nucleus, and I'm pushing in now to the posterior lens there. And lastly, we'll perform our von Herrick angle assessment. So I'm going to mag up to 16 and put my beam at the temporal limbus with a nice optic section, full brightness, and have my patient look straight ahead. And the depth of that shadow is definitely larger than the width of that corneal beam. So this is a grade 4. I'm going to do the same thing on the nasal side. So again, getting my optic section in focus at the limbus, and this is much larger than the thickness of the beam. So again, a grade 4. And I'm done.